I'm Dr. Jeffrey Hord and the director of the Showers Family Center for Childhood Cancer and Blood Disorders at Akron Children's Hospital. I have worked here now for 22 years. I started thinking about being a physician, I guess, very early on. I'm told by my parents that, when people would ask, what are you going to be when you're going to grow up? I'd say doctor. And I don't know really any particular reason why that was true. No one in my family's in medicine. So as time went on and I liked science and I did okay in school, then everybody just kind of encouraged that path and I followed it. As I started my clinical rotation in my third year of medical school, I was assigned to pediatrics, and the very first patient that I took care of was a little boy who had just been diagnosed with leukemia. His name was Michael, and one of the interesting things about Michael was that he was at his grandmother's birthday party and fell off a couple of steps on the front porch and he broke his arm. And really it was not a fall that anybody should really break their arm for. And so when they were taking care of his broken arm, somebody got a blood count and they saw leukemic cells on the blood smear. And of course his bones were fragile because of the leukemia that was going on, but that was the way it all happened. Yeah, the draw to pediatric oncology is one, dealing with children. And they're so resilient and they have such great personalities and great spirit. They don't tend to wallow in their own sorrow or their own woes. They continue to play and be kids. And so that's good for the providers and the team, I think. I don't know, there are times that when you see certain types of cancer, even in adults, it's attributed to certain lifestyles, certain behaviors. Maybe it's a substance they have used, maybe it's something like that. And these kids didn't do any of those things to deserve a cancer diagnosis. So you can't be more sympathetic than to a situation like that. So Akron Children's Hospital is a very special place, and I think one of the things that makes it that way is the fact that everybody here who comes to work every morning is focused on children. Whether it's the social worker figuring out, what types of financial assistance are needed, whether it's the psychologist helping to provide counseling and support to both maybe the child, but as well siblings and parents and all of those things. But it's everybody. It's the pharmacist, it's the surgeon, it's the radiologist, it's everybody. And so working in that team atmosphere, in a group where everybody's got that singular focus of making this child well and supporting them is what makes it a special place and makes the job a rewarding job.